Not.
The following is a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal, too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super, Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD. New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good evening. Hope you're fine and having a good weekend, a restful, quiet night tonight. This is the Radiosurgery Hour. We're here to talk about how to make your life better and healthier and happier and use data. We don't try to talk about things that don't have a backup data. So there's usually references of what we're talking about. I don't like to say XYZ is going to make you younger and healthier unless there's data that shows that, because it's not really fair to you to use my position as a doctor on the radio to say things without backup. So most of the things I'm talking about are real cases, real human beings that I see each week. We just made a new DVD, and if you call us during the work week, Monday through Friday, we'll actually send it to you. And the DVD is how we make this show. So last Sunday night, we filmed in the WOR studio. We actually filmed now about 4 times in the studio, and we made one DVD, and it's now available to you at no charge. There's also a question and answers about what is radiosurgery, because often people don't know what it is. Their other doctors don't really know what it is, and it's a misnomer. It sounds like it's some kind of surgery, but in fact it's not. The idea is to use the radiation beam as a knife without cutting. There's no cutting, no bleeding, no anesthesia, no surgery, no hospital stay, and yet we can attack tumors most anywhere in the body: head, body, prostate, and I can tell you about any place you can imagine, even your private parts. Yeah, we've even hit your private parts, your nose, your eye, ear, parts of the brain with radiosurgery. And that's the beauty. We can do it non-invasively without the cutting or the bleeding of surgery, and often without the convalescence of surgery and the complications of surgery. And sometimes many surgeries have about a 5% mortality or death rate. They have often very much higher complication rates, including infections, bleeding, blood clots. So there's lots of reasons to try to avoid surgery. Now, of course, there are some diseases that need surgery, but we're trying to find more and more ways to avoid that surgery, to avoid the hospital stays, cutting, bleeding, and things that probably you would rather avoid too. So when we started this program of radiosurgery 2 decades ago, some people thought we were nuts. And now, of course, they try to copy us, but at this point we have the longest experience and the most experience. We've treated about 20,000 patients. So it's really an unparalleled experience in radiosurgery. So anyway, that's what we're going to talk about tonight, and that's what we talk about a lot. That's how I spend my days and nights, and I like to do it because the treatment in general is so successful. No, we're not perfect. In medicine, there is no perfection, but the odds are with us. I used to practice medical oncology, and I saw what chemo would do, and in comparison, this is like the frosting on a cake. This is like having a fresh bowl of blueberries and raspberries every day that are tastier and tastier. So it's easy to see why one is so enamored with our work, because you should look at the results. And again, if you want to see books of our data, we have 3 separate books, one about brain tumors, one about body cancers, and one about prostate, with data and with examples before and after. So you can come to our office, or you can call us during the work week to pick that up or receive it in the mail, along with the new DVD about how we make this show. So I want to talk about a perfect case for us. A man came in this week, just a couple days ago. He's 73 years old. He has no children. He lives in Connecticut. He has severe COPD. Now, he smoked for 40 years, 3 packs of cigarettes a day. So to figure out how many pack years, it's the number of packs times the number of years. So 40 years times 3 packs is 120 pack years. And what did this do to him? Well, pretty much it's destroyed his lungs. He came into us on oxygen. He's on oxygen day and night. And now, not only did he destroy the lungs with COPD from the smoking, but now he has new nodules which look like cancer in the lung. And, of course, you can't operate when the lungs are so bad, because if they operate, they'll probably destroy the lungs, and then they'll even be in worse shape, and maybe he'll be a respiratory cripple. And there are some people who wake up and they just suffocate. They can't breathe because the surgeon took out too much of their lung. So he likes the idea of hitting these nodules in the lung with radiosurgery, a non-invasive treatment, and leave his lungs intact. He can't afford to get any worse. So he came in, and actually we have lots of patients like him who have come over the years because of our experience and expertise in non-invasive treatment. So, in fact, if you had to tailor-make a treatment for a patient, here we'd go. He has terrible lung disease. He's on oxygen. He has severe COPD. And now it seems like he's getting lung cancers, which are almost expected. If you look at the data, this is the main formula for brewing a lung cancer. Our success. So what is our success? Well, we've treated thousands and thousands of men and women with lung cancers. Actually, we've treated a few children also. And our success rate overall for lung cancers, where we aim the beam, we can stop or shrink or make that cancer go away 90% of the time for the rest of the life of the patient. I just came from a cancer meeting that was mainly focused on chemo and systemic treatments, and most chemo and systemic treatments, when they treat cancer, real cancer in the body, not adjuvant, when they treat cancer in the body, usually the responses are modest, the survival rates are modest, and the duration of benefit is modest. There's one thing that's not modest about systemic treatment, chemotherapy. The costs are incredible with all these new agents that everyone's clamoring for. Some of these costs are $8,000-$10,000 a month, and many of them just provide very marginal benefit. It's not like day and night. It's more like dusk. So this man, severe COPD, lung nodules, needs to stop those nodules, the cancer in the lung, from growing. Can't have surgery. We have plenty of people who can have surgery. They just don't want to have surgery. That's another whole group. If you can have equal or better results without getting cut on, hey, That's another kettle of fish. So yes, we see those patients often as well. This man is boxed in a corner. He doesn't have the choice about surgery. Other people with healthy lungs have the choice, and many, many come to us because of our expertise, because of our experience, because of a team that works together. In the center of Manhattan at 1384 Broadway. Many people ask these things, so I'll tell you right now. Our location is 1384 Broadway. It's the corner of 38th Street and Broadway. It's right in the middle of Manhattan. It's easy to get to. The Long Island Railroad, Penn Station, Grand Central, Port Authority, all the buses, the trains from New Jersey, PATH trains, and then all the subways, buses, and trains of New York City come pretty close to us. Many come to Times Square, many come to Herald Square, so we're super easy to get to, and that makes life easier for you. We don't think you should come because we're convenient, although we are super convenient. We think you should come because of the way we treat the patient, because of our experience, our expertise. We try to lay down the facts honestly to you, and then you make up the choice. We believe that the patient is the president of the United States of their body, and we, the doctors, serve the president. So we're like the advisor to the president. You get to hear the facts. You get to see the data. We try to give you copies of your report so you can exactly see what's going on, and we'll explain what you don't understand and give you documents or diagrams for the other things. So it's certainly worth a call. And again, to make an appointment, which is the best way to understand and learn the choices that are available to you, call 212-CHOICES. 212-CHOICES, which is 212-246-4237. 212-246-4237. Another man came in this week, 83-year-old man with 2 children. He's a widow. He has recurrent prostate cancer. Now, he had a prostatectomy. This is a man that worked in a hospital in Manhattan. He worked there for 38 years. He was the elevator operator, and he took up the President of the United States and prime ministers and kings in this hospital, so it was a highfalutin hospital. He got prostate cancer, and he went to the surgeons, and they cut on him. Now, he had a PSA of 8 at that time. So let's just look at the book, and you can get the copy of the book yourself and see what the data is. Let's say if you get the best surgeon in New York, not just the typical one down the street, but the best one at the most famous hospital, if you've got a PSA of 8 and you get surgery, well, your chance of being cancer-free with that surgery, with that surgeon, would be 76%. A lot of people think if you have your prostate cut out, you're home free. Well, this man had his prostate cut out. Well, he's seeing me, so I'm telling you, he's not home free. Well, the data, if you see the most famous surgeon in New York, have your prostate cut out, 76%. If the same patient came to us, the chance of success, this is our data, treating thousands of patients, and we monitor our patients, is 90%. That's 18% better. Well, there's 250,000 men a year with prostate cancer. That means if every man came to us rather than to that surgeon, the famous surgeon, about 40,000 more men would be alive cancer-free. 40,000 more men would be alive cancer-free if they came to us than if they had surgery. So it's telling you something. You should look at the facts before you jump under the knife. And what about the quality of life? Well, there's a new data from Harvard Medical School that looked at quality of life after surgery, either open or robotic. Well, what percent of men have sexual problems after open or robotic surgery for prostate cancer? 97%. Wow. Wow, oh wow. And what percent of men have urinary problems after open or robotic? Well, here there's a difference. Urinary problems after open surgery, 80%. Now, robotic's supposed to be better, right? Because they have the bells and whistles and lights. No, it's actually 86% of men have urinary problems after surgery with robotics. So sexual problems after surgery, 97%.